term in agriculture.
Great. My pen's not working, so that's not good.
Ted Lipsky, Representative Loyal One, Stowe, second by Annie Amanda Ag. Food Resiliency and Forestry.
Richard Nelson, Orleans One, which is Derby. First term,
Congratulations.
and so everything is a first, and class of 85.
All right, it's nice to meet an alum.
Greg Burt from Cabot, first term class of 08.
Awesome.
John O'Brien, I'm Royalton and Tunbridge.
Met before, John. Nice to
Yeah,
see
right, so I'm the one survivor.
you. Yeah.
Class of 75 here, by the
Look
way.
at that.
Wow, it's the end day here, yeah.
It's half and half.
Nice to have you back.
You've met Sidonia,
Yes. Thank you for all your help just getting here.
and just for the committee's sake, the folks who are not in the conversation but in the room, if you could just introduce yourselves quickly.
Sure, I'm the executive director. Amy Schulberger, lobbyist for many food security issues. And I'm an intern for Stats and Renfrew.
Welcome. And I think the door is about to open.
These out too.
I'm the lobby.
There, you just missed the introduction.
Others are.
That's all right. Would you mind introducing yourself just so that we all know who you are?
I'm Carrie Saylor. I am the senior manager of government affairs for the Vermont Food Bank.
I don't know, you have one more.
I do. Yes, I have two more. So I printed 8 because there's 8 committee members. So do you need another one? For anybody that's missing?
No.
Yeah.
Perfect. All right, I think we're all set.
Okay, great. Well, thank you so much for having me. I'll just briefly introduce myself as well. And congratulations to those of you on the committee or in the legislature for the first time. So I'm a professor in the Nutrition and Food Sciences Department at UVM. I didn't actually hear the majors, so we'll have to do that later. College of Agriculture and Life Sciences. I know my colleague Eric was here earlier this morning. So that's also my college. And my work focuses on food security. Actually, 2 areas. One today I'm going to focus on is food security. I also work and have talked with Chair Durfee about my research with agriculture and farmers. So a lot of my research also focuses on why and how farmers adopt best management practices. So cover crops and manure management strategies and things like that. So I work a lot with agriculture as well. But today I'm focused on my food security research. And so I've been at UVM for almost 10 years. And during the pandemic in particular, started doing a lot of research around the impact of the pandemic on Vermonters, Northern New England, and people across the United States and how it impacted food security. And that's work that we've continued ever since the pandemic. And so today I'm going to share some recent results from work that we've done in Vermont and Maine to really just help better kind of contextualize the challenges that food insecure households in Vermont are facing. The good news for you all, at least from my perspective, is I'm not here to directly ask you for any money, and I might be the only person to do that, but I think there's other people in the room who will take care of that. So I'm going to focus on, what data we have and sort of just help describe people's experiences with these issues. So before we get started, I did just want to acknowledge we have a really broad team. So our work is both University of Vermont and University of Maine. So the research I'll present today is from both states. But as you can see, a lot of different types of people involved and very different, backgrounds. We've got economists on our team. We have clinical nurse practitioners. We have people working in nutrition. So it's a really diverse group and also a lot of students and postdoctorates as well. So I just want to acknowledge all of the great work from our team, broadly speaking. And the data I'm going to present today is data that we collected this past year. So as far as we know, it's kind of the most up-to-date comprehensive data we have from Vermonters about sort of their current experiences with food insecurity. We have collected data basically every year for the last 5 years. So I'm happy to talk about historical things if you want, but really going to focus today on the data we collected this summer. And so we have about 1,400 people that responded to our survey that we did this summer, almost equally from Maine and Vermont. I am going to present all of the data together, but if you're ever interested to dig specifically into Vermont, I have those numbers. Not major differences between the two places. Vermont and Maine actually are quite similar in terms of their demographics and the challenges that they face. And so the data we have was collected from Vermonters and Mainers this summer. We did oversample low-income respondents because we're interested in understanding food security. And that is one major prediction of food insecurity is low-income status. So broadly speaking, we have about a half and half representative sample of people who are food insecure. So when you look at who responded and the data I'm going to show you from today, because we oversampled low-income people, 45% of our respondents make less than $50,000 annually. And I do have printouts of all the slides for you as well if you want to look at anything a little bit more clearly. About half of the people that responded got classified as food insecure. We do that by asking them a series of questions, 6 questions, validated and created by the U.S. Department of Agriculture, who measures food insecurity nationally. They don't know that they're being classified as food insecure, but after they take the survey, we take those 6 questions, and then depending on how they answer, they get classified as food secure or food insecure. So really, the goal of this data is to help show how food secure households versus food insecure households in our state are experiencing different issues and different challenges. So the data I'll show you today, I'm going to break it out that way. You'll see this is how food secure households responded to this question. This is how food insecure households responded. Yeah, quick question.
On your first slide, there was the word Qualtrics.
Yes, that's
Is that a company or a
Yep.
system?
it's both actually. Qualtrics is a national professional survey company.
Just
They also run a platform that collects data that University of Vermont uses and licenses to run online surveys and professional surveys. So it's both. They're actually based in Utah. Okay, so just real briefly, who are food insecure households? Our data tells us, and this is very similar to our other many years of data, they tend to be younger, at least in our sample. They are more likely to be women. They are more likely to self-identify as being part of the LGBTQ plus community, lower income, more likely to have children in the household, more likely to have a person in the household with a disability, and more likely to not own their own car, so transportation issues. They also are working families for the most part. So the majority of food insecure households are working. 62% have at least one full-time worker outside the home. 73% have at least one full or part-time person working outside the home. And the people that aren't falling into that category often are either retired, have a disability, or are falling into the seeking additional employment, which 12% of food insecure households were doing, which was significantly different than food secure households. So these are the kinds of households that we see when we look at food insecure households. I'm going to share a number of different quotes with you as well as I go through the presentation today, because I think it's really helpful to just hear the words of people who are food insecure in our state. So this is one person who really talks about at the end of the week not really being able to make everything work. This is a working person who works 40 hours a week. They pay $140 a week for their copay for their medical insurance. And their take-home pay was $136 in the week before. And they're really talking about how, to actually buy food, pay bills, and afford medical care on $136 a week is really, really challenging. And part of my goal for the presentation today is to really help connect what I call the complexity of food insecurity for households, not just in our state, but really across the country. It's this mix of challenges that low-income households are facing that I think need to be better connected. And those are both food access, healthcare challenges, and transportation in particular. Yep.
Chairman,
Go ahead.
how much is minimum wage in the state of Maine?
Oh, off the top of my head, I do not know the
Just
answer to
doing
that.
the math on that up there.
That respondent might be from Maine. I could look, but
Yeah, just, the numbers aren't not adding up if they're working 40 hours.
Yeah, I'm not sure if that respondent was from Maine, and I'm not sure off the top of my head what the minimum wage is, but I could certainly check for you.
I think.
But I will say, actually, all the other quotes, I do have the county that the person is from, including people from Vermont. So just to start real briefly, when we look at where people get their food from, I think it's important to recognize that food insecure households are more likely to rely on convenience stores and, not surprisingly, food assistance programs, a variety of different food assistance programs. So here we have in red, food insecure households, and in blue, the food secure households. And anything that's bolded or has an asterisk is a significant difference statistically. So you can see, for example, that food insecure households more likely to be using convenience stores, less likely to be using farmers markets, for example, and more likely to be using a variety of different food assistance programs, school meals, food pantries, other food assistance programs, or meal sites, for example. One of the other areas of focus of our work has also been looking at home and wild food procurement and the relationship of this to food security. And we have continued to show that actually this is an incredibly important area that many Vermonters and Mainers participate in. So here you can see that over or just around 2/3 of all of our respondents participated in some kind of home or wild food production over the past 12 months. You can see the specific activities that we asked about. And very consistent with our other data, we find that food insecure households in particular are much more likely to be doing everything else except for gardening. They garden at about the same rate as food secure households, but they're much more likely to hunt, fish, to raise livestock, have backyard poultry, or to forage as well. And this is a pretty consistent result. We've seen this for 5 straight years. We also see that food insecure households are more likely to want to continue to do these activities or to increase their activity and engagement with them. So we've been quite interested in better understanding this topic in particular. I can talk more about if you're interested.
Representative O'Brien?
Professor, is there never thought about it this way, but is there sort of a dollar figure per week or month per individual? I realize people do different things with food, but just you sort of need to commit this much money to food, just sort of calorically to get through a week and not, whatever that would be nutritionally and break it down by family.
So as part of the USDA Supplemental Nutrition Assistance Program, SNAP, food stamps, they have what's called the Thrifty Food Plan. And that is designed to be, on a budget. And I'm sure my distinguished food security colleagues in the room could talk more about this with you as well. That is designed to be, on a budget. This is how you could, this is how much you need to actually meet your caloric needs and nutritionally to do it. There are, resources out there about that. Off the top of my head, I don't know the exact dollar amount per week, but what I will show you in a couple of slides is what Vermonters and Mainers told us how much additional benefits they might need to meet their family's food needs. So hold tight.
Thank you.
One other area I did want to mention was the use of these food assistance programs. So as I said, food insecure households are more likely to be using federal programs. The most common one is SNAP. And so what we found, though, was interesting that only 57% of people that were classified as food insecure were actually enrolled in SNAP in our sample. 43%, therefore, of food insecure households are not participating in our data set in these federal programs. And we actually see very different kinds of households that participate in SNAP or don't, depending on their food security, even though they're all food insecure. So households that are not participating in SNAP are more likely to be higher income, to not have children in the household, to have a college degree, and to have someone in the household over the age of 65. They're also more likely to be working full-time and not have a person in the household with a disability. When we look at this further, this is really interesting because we also asked people about the kinds of financial impacts that they have faced since the pandemic. And what we see here is that while SNAP households were more likely to do things like missing utility payments or unfortunately missing rent payments, households that were not enrolled in SNAP and were food insecure were more likely to be struggling with medical debt and medical bills, as well as student loan bills, and only paying their credit card minimums. So this is a different kind of food insecure group, potentially. You know, there's the groups that are able, or not able, but are enrolled in SNAP. And there's also a group of food insecure households that are not enrolled in SNAP in our state and may have different challenges. And some of these may be what are called ALICE, so asset limited, income constrained, but employed. These are people who are working, but they might be right at the edge of those benefits. They might not qualify because student loan debt doesn't actually count towards allowing your income to be reduced for SNAP, for example. So there's a group of people out there who aren't able to participate in the programs, for example. This is an area I'm working with our state agencies a little bit further on to investigate, but did want to acknowledge that there are food insecure households out there who are not participating in federal programs. And there's a lot to unpack as to why that might be. Here's your question, Representative O'Brien. So what we did find when we asked food insecure SNAP recipients about how much additional benefits they might need, on average, this is the last bar here, those that are classified as food insecure indicated $288 a month in additional benefits to meet their family's food needs. I could break that down by household size. We have that information, but roughly, if you assume a household of 4, you could sort of think about, $75, $70, $60 a week, for example, to meet their additional food needs.
Food benefits, right? Not
Food benefits.
everything else, I
Yes,
guess.
just food. Yes, we'll get to medical. So one of the areas of interest over the research we've been doing for the last 5 years, we've been getting a lot of questions like, why are people still food insecure? We had all these programs during the pandemic, didn't they work? Why are we still seeing these levels of food insecurity? And one of the things we added to our survey this year was to try to understand what we call these adverse financial events, and to understand the extent to which these may be impacting the continued food insecurity that we see. So here's that list again. Now I'm just breaking it down by households that were food insecure versus food secure. And we asked people if they'd experienced any of these events since the COVID-19 pandemic. So basically in the last 4 years. And you can see there's really significant differences. So food insecure households much more likely to face a lot of adverse financial impacts during the pandemic. Missing payments for utilities, new credit card debt, only paying the minimum on their bills, unable to pay their medical bills, or missing rent payments. Those are the top 5 most common. Down towards the bottom, you see, even 8 to 7% are unable to pay their loans or dropping out of school to work, for example. So overall, we see that food insecure households today were much more likely to have faced a lot of these adverse financial impacts during the pandemic. We also see, when you look at the relative difference of those between households that are food secure and insecure, you see, even though some things are quite low, like dropping out of school to work, only 8% of food insecure households did that. But the relative difference between food secure and insecure is really large, 7 times greater, 720%. So this just helps you sort of see that there are some relative magnitudes of difference as well between these experiences. And when we just look at the averages, probably the easiest way to understand this, the average food insecure household faced 3 of these financial impacts compared to 1 for food secure households. So it's not just that they missed a rent payment. They also had to drop out of school. They also couldn't pay, their medical bills. They're not just facing 1. And so some of the analysis we're doing right now is directly looking at how these adverse financial events are directly predictive of the food insecurity that we see today. These are some of the reasons and the ongoing challenges that people have faced. Here's a couple of quotes to contextualize this. So a female respondent, family of 4 from Bennington County, "I will skip bills to make sure my family eats, but this puts us behind on bills." Another person from Orleans County told us, "It made it so hard that I had to choose either to pay my bills or not to eat. I can't live like this anymore." And someone else from Addison County, where I live, I lost my pandemic Medicaid, and but now I have insurance through work. I need to see a physical therapist because of a new mobility and pain issue in my leg, and I can't because the copay is $50. And all I have left after half my bills, rent, and not enough money for groceries and household needs is $60 a week if I manage to make commission on sales. That's a family of 3 in Addison County. So you can see there's just a lot in the mix for food insecure households. We also asked about some of the food access challenges that people have faced over the last 12 months. And here we also see, it's not surprising. We know that income status is a large predictor of food insecurity. So it's not surprising that 78% of food insecure households lacked money for food. But we also see a lot of other things bubbling to the top, in particular transportation, which is a theme that we also see as I present some of our healthcare data in a couple of slides, and as well as what we're broadly calling time poverty. So these are lacking the time to cook or the time to shop, or maybe the availability of when stores are open doesn't align with someone's work schedule, for example. So those are some of the 3 big challenges that we identify. The money one's not necessarily surprising, but the transportation issue and the time poverty issue also come up as top issues here. We also asked people how they were directly responding to higher food prices and inflation. And this is where we see some strategies that, as someone in a nutrition department, we would tend to start to think could be affecting diet quality, nutritional quality, or food security. So purchasing cheaper food is a strategy that we're seeing actually majority of food secure and food insecure households doing that. But purchasing less food, so possibly eating less, purchasing less animal products, so high quality proteins, shopping less frequently, and also purchasing less produce, so less fruits and vegetables, possibly in someone's diet, because those we know can be more expensive. Here's a couple of quotes to contextualize this one. So someone from Somerset County, Maine said, "I have to rely on others for transportation, have little money to even partially compensate them." Someone from Windham County in Vermont, family of 5, told us that inflation makes it extremely hard to keep food in the house for my kids. We try to do cheap budget meals when it's very hard times, but we can't even do that with the prices of cheaper things either. And then someone from Chittenden County in Vermont told us not buying the foods I like and prefer to eat was a strategy. This person had a lifelong history of an eating disorder and currently has chronic health conditions, including missing teeth and severe TMJ. If the food I prefer to eat is too expensive or too difficult for me to prepare, I either don't eat or choose easy but not as nutritious substitutes. So just to switch gears a little bit, I want to talk a little bit now also about health and healthcare. We have continued to look at these things in tandem because we find that so frequently families that are struggling with food access are also struggling with health access and healthcare access. And the 2 are deeply related. If you can't receive high quality care or you can't afford nutritious food, your chronic health conditions might be compromised, for example. So we also asked households about healthcare access barriers and challenges. And similar to food, we saw that food insecure households were much more likely to also face healthcare access barriers in the last 12 months. Inability to find an appointment, access to transportation, or affordability for the provider visit, as well as not being able to take time off work. Again, that sort of time poverty issue, balancing time issues were the big issues. Although we also see poor internet for telehealth, and I know broadband is an interest for the state and for Maine as well. A couple of quotes from people that told us about this. Someone from Windsor County, Vermont, family of 5, told us, "I finally went to the doctor after roughly 10 years. Even having routine tests done with my employer provided insurance cost me over $600. I can't afford to do that again. It's horrifying. I'm my children's sole provider, yet I can't provide for myself to help make sure I'm there for them. It's a constant worry." And we also had someone from Cumberland County, Maine, tell us they didn't have money to pay someone to give a ride for them. So if they can't do telehealth, if they can't do an appointment over the phone, it doesn't happen. One theme that really came out, and I'm hoping to have some conversations with the health committee as well, is dental. We had a lot of comments about dentists and dental care. So someone told us okay, well, I have the medical care, but also now I'm dealing with bills from vision and dental care that are more than the medical care. Someone else told us that they felt like the dental insurance not, being part of a traditional Medicare plan was a real problem, and that oral health was very important. That was someone from Addison County. Someone from Orange County, a family of 5, talked about the lack of doctors and dentists in Vermont who take new patients, especially ones who would actually take Medicaid or Dr. Dinosaur. And then we also had a lot of comments about specialists. And so someone from Orleans County also said, shortage of doctors in my area, I have to travel 2 hours to see specialists. I mean, we've all seen this, many of you are from these areas. It's far to get, in a rural state to see specialists. Just to wrap up, a couple of other things that we've consistently seen is the relationship of food insecurity and chronic diseases, in particular anxiety and depression. And so in our survey, food insecure household respondents had twice the rate of diagnosed anxiety or depression as compared to food secure households. This is the top 2 here. So food insecure respondents, 55% screened as a diagnosis of anxiety, 50% a diagnosis of depression. And unfortunately, only a third of food insecure household respondents had received mental health therapy in the last 12 months. So we have a real gap between diagnosis and actual mental health responses. Someone talked about this in a quote they told us where they really couldn't do anything beyond a physical and there was no mental health care coverage in their work. Lastly, we also found that a lot of food insecure households told us they were stopping or skipping their medication also because of the cost, which is not something until our most recent survey 2 years ago we'd ever thought about on our team, but it's all related. It's all about money and financial resources. And so we do see, for example, that 15% roughly of our food insecure households stopped or skipped a variety of different chronic disease medications. And this came out in a quote from someone here from Cumberland County who at the end said that, they actually are deterred from picking up their medications or refilling prescriptions because it's so expensive every time they go to the doctor. So just to wrap up, a couple of key takeaways and next steps for our team. One of the things I want to leave you with is how interconnected some of these challenges are, and to just encourage you as a committee to continue to have conversations with other committees where we know that these issues interact. So food insecurity, interacting with healthcare, interacting with transportation, for example. What we really see is a financial shock affects the financial resources that a household has, which affects both their healthcare access and their food acquisition, goes on to affect food security, stress, and chronic disease. And we see this directly in the data I presented today, that food insecure households were up to 8 times more likely to face a financial shock. We see that they're reducing their purchasing cheaper food, purchasing less fruits and vegetables, lean proteins. They can't afford healthcare because of a lack of providers or insurance issues. They have double the rate of anxiety and depression, and they're lacking mental health therapy and stopping and skipping medications. So unfortunately, this turns into a cycle if we're unable to provide additional resources. And of course, that's where safety nets and programs can come in to help alleviate these issues, either when the shock happens or after, as is the case that we're in now, almost 5 years after the pandemic. So just a couple of things that I think, I'm not here to say do this and do that. I'm happy to talk about our data, and there are other people in the room who might advocate for certain issues, but these are 3 key things that we really see come out. So as you think about solution sets, I would encourage you to think not just about the financial piece, but the transportation and the time poverty issues. And I think the other thing that we're really interested in from a research perspective is how do we better couple food and healthcare access? We know that it's the same populations of people who are struggling with both healthcare access and food access. And I also would just like to remind people that based on what we know from the most recent 2008 recession, recovery from food insecurity spikes can take 10 years. So the 2008 recession, spike in food insecurity, those numbers stayed high for 10 years. So we shouldn't be surprised that we still have higher rates of food insecurity now, 5 years after the pandemic. Just in terms of next steps for our team, so we have a lot of data. And if you want to dig deeper on any of these things, I'm very happy to present additional research or go deep on something, divide numbers out by Vermont, we can look at our data in a lot of different ways. So if there's anything that's of interest, I'm happy to take note of that and follow up with Chair Durfee about those things. We also have ongoing research funded. So we currently are funded through the U.S. Department of Agriculture, and we have some forthcoming funding continuing in that space. And we also are working on some policy modeling right now, looking at the effect of additional SNAP benefits at the state level and how changing benefit levels might impact food insecurity and for what kind of households. So that was all I had for today. Just want to acknowledge we have an advisory board of fantastic individuals, as well as our team, and happy to take questions if there are any. Thanks so much for the opportunity to be here.
Thank you. Representative Berkey.
Thank you. You have data on access to healthcare. One of your quotes mentioned a woman who was struggling to pay for her medical or dental bills, and it was due to being on Medicaid or Dr. Dinosaur. I know my family, we're actually on Green Mountain Care. And our co-pays, thankfully, at the dentistry that we go to are nice and are low. They're affordable. Do you have any data on that? Or have you done any research into that in terms of access to healthcare?
We know exactly what insurance people have.
Okay.
So
Maybe what the barriers are like for that individual. I'm just curious why they wouldn't, what would make it so that someone would qualify for Green Mountain Care and then another person would in our own state.
Yeah, that's a good question. One of the things that we could look at further here is, so very few people are uninsured. I will say that. That I think it's roughly 3% of our respondents have no insurance.
Okay.
So vast majority have insurance.
Yeah.
What we haven't looked at yet, but I'm happy to dig into, is how the insurance type that someone has affects, some of these access issues, for example. Or are there certain kinds of households that seemingly either aren't able to utilize benefits, or maybe they don't know that they exist, for example.
Right.
So I'm going to make a note of that and I can follow up. But we do have that information. So we know the kind of insurance that people have, and we could dig deeper into that.
I appreciate the idea. It's just specifically in those cases where someone is saying, they're not accepting this form of insurance I have. Well, do they have access to, could they have Green Mountain Care and not even know that they can?
Certainly, we have some qualitative comments about people like not knowing where to figure out this stuff. Like they're like, it's too complicated. I don't even know where to go to figure this out. So we definitely do have some of those qualitative comments from people. So the information to help people understand what their benefits are does still, we still see evidence of that being confusing. Yeah.
Appreciate it. Thanks.
Term time poverty in one of the last slides. I'm not sure if you defined that. I think I understand what you mean, and just in the context of the family that struggles to figure out how to apply for a benefit, for example. Then there's the question of the time that it takes. Is that what?
Yeah, we see time poverty come on a couple of different places. So I think that is an example of one, right? The time it takes to figure out, these things. Here's a couple other examples. Lacking the time to cook or to shop and find food, or maybe when locations of a store are open in their town, they're working, for example, or they don't, they can't figure out how to get to those locations. So it's a broad term that we're kind of categorizing a number of different things, but thinking about the complexity of navigating the healthcare system and having the time to do it, or the time to cook and prepare meals and go to the store. And I think the other thing with a rural population, there are sometimes only one grocery store or one general store that someone can get to. And so those hours might not align with someone's work schedule, for example. So we're using it as an all-encompassing kind of term to describe a variety of situations in which someone, especially, food insecure households that are working, which is the majority of them, might not be able to figure out how to make it all work. Yeah.
Representative O'Brien.
A couple of things. One, do you track, say a family that was food secure in 2010, and check in every 5 years with them? Just because I can imagine it's very hard to come off, food insecurity once you sort of have all these pressures on you?
So this is what's called cross-sectional data. So we have two different data sets. What we have is sort of these annual surveys that we've done, which are not of the same people over time. However, at the start of the pandemic, my lab, our team, did actually run a survey of Vermonters that we then also surveyed again. And we still have permission to recontact 1,800 of those people. So there could be an opportunity to resurvey that. And that was just Vermonters, that group of people. We did publish one paper looking at that group of people over the first year of the pandemic to understand kind of what their experiences were. We've also looked a little bit at how people's food insecurity has changed over time during the first year of the pandemic, because we used to ask about retrospective food insecurity. But now it's kind of too hard to do that. It's really hard to ask someone 5 years ago, like, how did you? So we're not doing that anymore, but we do, and I can send that one paper that we did have published that did look at over the course of a year, how people shifted. We did see some of that in the first year of the pandemic, because what we did see in the pandemic was a lot of people became newly food insecure. We did see some new households come into food insecurity that had not experienced that before for a variety of reasons. We did see some of those households come out of food insecurity, but we also have a lot of other people who, have not recovered. And the national data, the best numbers that we have nationally and in Vermont for food insecurity have continued to show the most recent data published in 2024 for food security in 23, there has continued to be an increase. So between 2021 and 2023, relatively like a 30% increase in food insecurity nationally, and Vermont kind of mirrors that trend. Yeah, but I can follow up with that one paper and send that to the chair as well.
Representative Nelson.
Yeah, animal science, by the way.
Oh, nice. I do a lot of work in dairy, so we can talk about that another time.
Have you asked a question about level of education?
Yes. Yep, absolutely. We see that come out early on in what I presented, and you have the slides as well. So
Okay.
Food insecure households less likely to have a college degree in particular. And so we do see, and that is sometimes correlated with income, but we do see that. We also can break that out further. We have everything from didn't graduate high school through to like, I have a PhD or I'm a judge, I'm a lawyer. So education is a predictor or at least an associated relationship to food insecurity. But as I mentioned earlier, what we see for those households that are food insecure but not necessarily receiving federal benefits, they're more likely to have a college degree, but they're sort of on the edge of that benefit cliff, meaning they're right on the edge of, in fact, because I think a lot of them have student loans. That's what we have in our data too.
Yeah.
So there's some education relationships here.
Debt's a part of it.
Debt. And Honora could tell you more about this, but the way SNAP benefits are calculated, student loan debt is not considered as part of what you can deduct from your income in order to qualify. So this is a group of households that might have college degrees, but those student loans are not able to be deducted from their income to qualify for food assistance.
Is the SNAP program enough to help people, or is it, 85%, I think it's 85% of the farm bill.
Yes, 75. I teach food policy. I could tell you all about
It's
it.
75?
75% of
The
the,
farm
or
bill?
80 roughly is SNAP.
SNAP program, okay. Have they froze that and it hasn't risen for inflation or something?
Another great question for Hunger Free Vermont. So the Farm Bill has been extended for another year. Part of the federal debate right now is around SNAP because it is such a large portion of the Farm Bill. Part of one set of proposals is to actually freeze that thrifty food plan, which normally would rise with the cost of inflation. And that is how SNAP could increase. But there's some proposals to sort of freeze that so that it doesn't rise with inflation, which would reduce the costs. So, however, I would say based on the data that we have, the households that receive SNAP are not having their needs met, right? I mean, that is exactly what we see
Mhm.
right here with this data. Right?
Yeah.
$288 a month is the average additional benefit needed by food insecure households in our state.
Looking at it, talking to farmers across the country. A lot of farmers get upset that the SNAP program is in the farm bill because people look at the size of the farm bill and they say, look how much money the farmers are getting.
Mhm.
75% of it's SNAP. I look at it and say it's our duty to help feed the people. And doing it through the farm bill is fine with me, and that gets people in New York City to vote for the farm bill.
Which is historically why they're together,
That's
actually, because you needed the
exactly.
urban and the rural populations to come together to
Exactly.
find common ground.
The rural population is feeding, or a big share of the rural population is feeding and also where a lot of the issues are,
Mhm.
sadly.
Yes, yes, the rate of food insecurity in rural places is higher. Also, the chronic disease burden in rural communities is higher. It's why my research focuses in rural Vermont and rural America, because they face a lot of challenges.
Lack of
And they're unique
services.
challenges, lack of services, transportation challenges, doctors, all the things you heard about today.
So maybe you didn't agree with the Green Mountain Care Board saying they needed to shut down 5 hospitals in the state of Vermont and leave us in healthcare desolate deserts.
Yeah, well, I would argue that we already can see that
Yeah.
Vermonters, especially rural Vermonters, struggle. And that's going to have a huge impact on a lot of rural people.
Thank you.
Yeah.
Connection between healthcare and food.
Yeah.
Healthcare and lots of other things. It's an important part of our larger conversation. I wanted to ask about, just to clarify really, you pointed out earlier on that you oversampled lower income households, and then I think about half of the sample that you did have was
Food insecurity.
you were categorizing as food insecure. Just want to be clear, that's not.
That is not the rate of food insecurity.
That's not the rate of Vermonters that are food insecure.
Absolutely not. No, and that's why I wanted to be super clear here that we did purposely oversample, or we have an oversample here of low income households.
Yeah.
The goal or the good thing about that is that we now have a large enough sample size with our data, enough people equally split between being food secure and food insecure, that we can really better understand these things. Previously, when we've tried to collect like representative samples, once you wind up getting the number of people that are food insecure, and then you want to look at that by county or by, this education status or something, you wind up with 20 people and you really can't understand statistically what's going on. So now we have kind of 1,500 people roughly equal food insecure, food secure. So no, the rate of food insecurity in Vermont is certainly not 52%.
And it's not the purpose of this research to identify that rate.
No. Previously, we have tried to put a number on the actual rate of food insecurity in the state. I would say the most recent data, from the USDA is probably the most reliable source we have. I would also say, from my perspective, I don't think it's worth nickel and diming over like whether it's 15% or 14% or 20% or 30%. The trends are what our lab and our team have continued to look at. And what we have seen consistently with the data we've collected at the state level, the national data is the same trend, that after the pandemic, the rate's gone up. And even the USDA data, national data and Vermont data shows, roughly this 30% increase over the last several years. And like I said, consistent with the historical data we have from the 2008 recession, we shouldn't be surprised by that. And it's probably not done even going up potentially. And then it might stay high for roughly 10 years.
Until next.
Until hopefully, that is the real challenge here, right? I mean, the other part of my research looks at, extreme events and climate change and how that's impacting farmers and agriculture and food security. And So then you start to see these compounding potential adverse events, right? We've had the pandemic and now we've had floods for 4 years in a row here in Vermont. And for some households, that's just been devastating.
You think in Western North Carolina, maybe they're having issues right now?
Absolutely. Absolutely. I mean, my husband's college friend is from Swannanoa, which got wiped off the map. So
There are questions. What we didn't talk about, I don't think, was the definition used here of food, of being food insecure.
sure.
And can you talk to that at all?
I can tell you how we measure it. I can also kind of broadly define, there's a lot of terms out there. So the USDA, Department of Agriculture, is the one who nationally sort of has these tools that they use to measure food insecurity. And those have been around since the 90s. They actually haven't changed much. And our team has advocated that we should change them, in part because they only ask about money and financial resources to afford food, whereas we think there's a lot of other things that are overlooked. That being said, we use 6 questions in our survey. These are questions about like whether or not someone was worried about food or affording food or having enough to eat, as well as questions that are more specific about actually limiting the amount of food that someone has eaten, like if they've stopped or skipped meals and how frequently. So of those 6 questions, if someone answers 2 or more affirmatively, yes, they are classified as food insecure with that instrument. It's validated across the entire country. So that's what we've used. There's also, more attention now to nutrition security. That might be a term that you would also hear. There's been a bit of a shift. So food security historically, I could give you the whole definition, but it's focused a bit more historically just on food. And there's a real focus now also on nutrition security, which is giving more attention to actually the content of the food, not just calories, that we need high quality, nutritious food, diverse diets to actually, thrive and to help people be at their best. And so there's more focus now at the USDA and from other organizations, not just on food security, not just enough food on your plate, but the right kinds of food, nutritious food. And also recognition that marginalized communities in particular are at greatest risk for food insecurity and nutrition impacts.
Along those lines, I was just thinking, do you study sort of what I might call like accelerators? Like I can just see that the sort of feedback loops that are happening. So once you are food insecure, the sort of levels of anxiety, depression, stress, pick up, they go faster because they all work together sort of against you. And I can see that like even how stress, I think, could sort of make whatever nutrition it is in, what nutritional things you're getting, the quality of them could get worse in a lot of ways because if things are going bad, you're in debt, for example, you probably don't make good nutritional choices. You
don't have the capacity to.
Right, or you turn to drugs or alcohol, more things like that to alleviate stress in some ways.
Yeah, we have data on substance use. I didn't include it here. I can share that data. We do see higher rates of substance use with food insecure households. Not alcohol. Alcohol use is actually less in food insecure households as compared to food secure households, but other substances are higher in food insecure households. So yes, what you're describing is an unfortunate, well-documented feedback loop and challenge, within food insecure households. And when you put the medical on top of that, there's actually a really interesting book a few years ago, and I can't remember the author. She's a academic that talked about this as weathering. Like you think about geologically rock weathers that people can also weather, and that this constant stress of facing financial burdens, food insecurity, chronic health conditions could be weathering to an individual or a family. So that is why our group has continued to focus on these things together, because at first we just focused on food insecurity, but then we started seeing all the data and we started hearing from people like it's not just food insecurity, like these things are deeply connected with other issues in our state. which is why we're trying to sort of broaden the conversation and not just speak to the Health Agriculture Committee, but, you know, also to transportation and health and better connect these challenges.
Take one more question.
Do you have a breakdown of how many people answered the 6 questions?
Yes.
And then does it show how many people answered multiple of those 6 questions or just? Because that would be very interesting.
Yes. So 52% of our respondents had at least 2 of the 6 questions affirmative, which is how we then qualified them as food insecure. There's also a definition for very low food security, which is when food insecurity is sort of a spectrum. So on the one hand is worry about food and an anxiety about food, which is different than hunger. Hunger would be where you're cutting meals or actually, you know, compromising your diet quality or intake. And so very low food security actually is when people are starting to do those kinds of things, where they're answering 4 or more questions, meaning they're cutting meals or they're being impacted. So I can share that data. We have that breakdown. I've just sort of presented the
Yeah.
basics here, but it's not just people worried. It's people actually cutting meals
Yeah.
and being impacted. Their diet quality is being impacted as well.
We don't have any questions on Zoom in this interview. Everybody's saying it's okay. All right, I think we'll say thank you then very much for coming in, sharing this information. We're going to continue on the same theme after we take a short break. So committee, why don't we take 10 minutes? We can all be back at 5 after. And I'm just going to say now that
First term,
Just,
how's it going so far?
you've unmuted. I just wanted to